Today, councillors have undertaken a big 10-year strategy to make sure that we have the housing available in our county to meet the needs of elderly and disabled people. The good news is that we have enough for the next 2 years, but housing takes a while to get on stream, and so our plan is for the next decade to ensure that we have suitable housing. That includes creating housing for people who are currently forced to leave the county to get specialist provision to help bring them back closer to home, and also to provide housing for elderly people who need specially adapted accommodation but don't want to move away from friends and neighbours and family members. We've increased the funding for the next 2 years so that the schemes to address homelessness, particularly in the city of Cambridge and in Fenlands, and extra care schemes, they're the schemes whereby people still have their own front door but get care at home. Fortunately, care is charged for. The council is forced to do that in order to be able to provide the services it does. But we've particularly reviewed that to take account of poverty and the cost of living crisis, and to make sure we take what action we can to provide relief to people who are finding it difficult, including taking a decision to employ more welfare benefits advisors so that people are helped with filling in the forms so that they get the maximum income they can to help them. We called in the emergency and urgent care services from the National Health Service, our health scrutiny function, and we asked them when they're going to suffer the biggest demand ever over the course of this winter, what progress they're making, what more they can do, and we particularly scrutinised their plan to say that you have to use 111 first before you access emergency care, even if you turn up at the hospital. They're confident that people can still be helped to make the right choices, but it is proper that we ask the questions that we did on behalf of patients. Another really successful day for the Council's Adults and Health Committee.